If you are nearing the end of your pregnancy and struggling with swelling in your feet and ankles, then this video is for you. We are going to talk about what you can do to reduce or stop the swelling and discomfort. I'm also going to bust the top myth around pregnancy and swelling, so stick around to the very end to learn something new. 80% of pregnant mothers have swelling or physiologic edema. So this comes from the adrenal glands producing too much aldosterone and cortisol, which draws in extra fluid. During a normal pregnancy, total body water increases by 6 to 8 liters. Fluid also accumulates because the weight of the uterus and your feta tends to sit on the inferior vena cava, which is controlling the blood flow coming back from your legs and your lower body. And this fluid can accumulate in your lower body and then seep out into the tissues. Most often, it's not a cause for concern. However, if you do have any of the symptoms to the side of me, it could mean something more serious is going on and you would want to contact your doctor immediately. Things that you can do to help reduce or stop the swelling are lying on your left-hand side as often as possible. This is going to take the weight of your uterus off your inferior vena cava and allow that blood flow to come back from your legs back to your heart. Resting and elevating your legs as frequently as possible is also really helpful, aiming for 20 minutes at a time, at least 3 or 4 times per day. Wearing pregnancy compression stockings can be very helpful, as well as avoiding anything that has tight around your legs that could avoid the flow of blood coming back to your heart. It's also helpful to exercise for 30 minutes a day. I'm going to link to an exercise class for swelling there, or you can find it in the description box below. With the extra fluid needs and blood volume expansion, it's of course also important to stay hydrated, drinking lots of water, limiting caffeine, and along with this extra water, we also need extra electrolytes and minerals. So making sure you're having enough potassium and sodium, so not by increasing the processed food intake, but by including unprocessed sea salt, can find that balance which can help reduce swelling. An Epsom salt foot bath can also feel amazing, so if you did that for 15 minutes and then elevated your feet, that would be ideal. Something that's not talked about is limiting sugars, especially fructose and high fructose corn syrup. So some research has shown that limiting these sugary beverages and high fructose corn syrup can decrease swelling and blood pressure. That brings me to the number one myth, that salt is causing edema or that you should be on a low salt diet. There was a meta-analysis done, which is a review of all the evidence-based research, and the conclusion was that a low-salt diet should not be recommended during pregnancy, and this is even true if a pregnant woman has high blood pressure or edema. Some of the research suggested that even more salt was beneficial, and especially not less salt. Once again, this does not mean it's beneficial to increase your processed foods and salt and snacky food intake, but it can be beneficial to flavor your food with unprocessed sea salt like Himalayan pink sea salt. You can also enjoy foods like pickles and sauerkraut. If you've tried some of these or something helped you, let us know in the comments below. And of course, I will keep making pregnancy workouts, yoga, Pilates every week. If you like videos like these, subscribe. I'm going to link to the pregnancy swelling workout right there and the whole pregnancy workout playlist. You can save it and come back to different workouts whenever you like.